women that were coming into the shelter from the street that were, COVID positive, and the procedures that we had to do in regards to that. Segue to working here. We had a patient that I knew her last name was a Cree name, because usually we know by the last name where they're from across Canada. And I knew that she was from Saskatchewan, right? That name was from Saskatchewan. And I thought I would go, and she was in an ICU, and she had been in a shelter. So she had no choice. She had to be around other people. And at that time, it was early days in the pandemic, and they weren't expected to wear masks at that time. This is how early it was. I mean, I think it was a month and a half, 2 months in, and it started to explode, and we had started having a lot of people in ED. So we would, oh my goodness, it would take us half an hour to get everything on. But, we went in there, and she was in the ED. And so she was in there for days upon days. I felt really bad for her because she was in a shelter. I mean, she didn't know, no one knew. And she had to be there. They all had to eat together. So she had no choice. I'd go every day, and I had the sweetgrass I put above her bed to protect her, right? And I prayed, and I had blanketed her. And I was at the foot of her bed, and she was intubated. But I talked to her, and I prayed, and I'd pray every day, that I did go to see her. And this one day I went, and I said to her, the RN, I said, so how's she doing? She did, and the RNs are, God bless their souls, when you say, how are they doing? They don't want to give you bad news, but they want to give you totally the truth, right? The next morning she woke up. I went to see her, and I was just so happy. They said she made it through the night, and she woke up. She woke up this morning, and they were really surprised. The RN was really surprised. We're very, we didn't say it in so many words, but their eyes were like surprised when they looked at me, like she woke up. Like they thought she was gonna pass, right? But she woke up, and I followed her for the time that she had, and they did an amazing job in the ED. And I could have gotten, my mother's 78 now, I could have gotten COVID too. There was no cure at that time, but we did the work that we had to do for our Indigenous patients, even if they were in ICU intubated, and we didn't know if they were going to make it because there's no cure, no vaccine. But we pushed ahead. When I walked into the door there, of course, again, I was all PP'd up, and I said, "Danse," at the door, and she was asleep. She woke up. She said, "Wananto." She looked at me, and we started laughing. I said, "I've been following you the whole time you were intubated. And I gave you that blanket. Did you get the sweetgrass?" She said, "Yeah, I was wondering where it came from." And it was like she was my older sister. And it's like we knew each other. It was like we knew each other. And to see her alive and all the work they did, and it was really amazing. And I felt so sorry for her because our people have suffered for so long. And she had no choice but to be in that shelter. And I followed her from there. She went to Holy Family Hospital. We worked with a social worker to get her a place to stay. And she got her cat back, and she got her home place. And shortly after, her son had passed from an overdose. And but she was doing really well, and she was an amazing lady. And I've seen her a couple times. She's come to the ED. I go down and say hello to her. And she's just like an older sister to me. So this is why our work is so important.